Hello everyone and welcome into another episode of Ask the Doctor. Today we're going to be talking about a very special topic as we have Dr. Brian Seng with us to discuss the new robotic system, the VELYS, and how it is helping him provide the best healthcare possible. Well, Doctor, to start out with, what is the VELYS system?
The VELYS is a robotic knee system that uses robotic technology and advanced computer technology to allow us to put knee replacements in a more accurate position, as well as give us immediate feedback during the surgery of what the knee might act like after we're done with the surgery. And so it allows us to use this new technology to put knee replacements in a more precise way. Robotics take many different forms. So in the automotive industry, the robot is actually putting screws and bolts on a car, putting a fender on a car. In joint replacement surgery, the surgeon is still the crucial part of putting those implants on the patient. What the robotic system does is it gives us computerized data that drives the robotic arm to make the cuts on the bone with the robotic arm and the robotic technology. So the robot kind of drives how we cut the bone, but more importantly than the actual robotic piece is the computer data that it tells us as far as the angles that we're cutting the bone and on the soft tissue tensioning of the ligaments. But it's still the surgeon making the cuts on the bone.
How would you say it's different than other robotic systems that you've used in the past?
So robotic technology has been around for a few years, and in the past those robotic systems required CAT scans or maybe an MRI prior to surgery that then the computer would use to help plan the surgery and then to perform the surgery in the operating room. The VELYS system utilizes a platform that does not require any preoperative imaging like CAT scans or MRIs. So this way it's a cost savings in that we don't have to obtain some of those expensive scans before surgery, and then it just simply uses the information in the OR of the patient at the time of surgery to get the information that we need to perform the surgery.
How does a robotic system like this help improve patient care?
So the VELYS system and this robotic technology allows us to somewhat customize the knee replacement at the time of surgery to each individual patient. And it gives us real-time data and information on the patient that we're operating on that may be a little bit different than the next patient that we operate on. And so with this information, we can make small adjustments to the implant positioning that may help improve the outcome for the patient after surgery.
The VELYS talks about joint stability. What do they mean when they say that?
So one of the advantages of using robotic technology and some of this advanced computer navigation is that it gives us information as to the tension on the ligaments during surgery. And the ligaments are very important for creating what we call a stable knee replacement, which means ones where the ligaments are balanced in a way that it gives the joint the stability that it needs to do the activities that patients want to do with their knee replacement, whether that's golfing or playing tennis or going to the beach, things of that nature. The VELYS system has this technology in it that gives us real-time information on what those ligaments are doing during the surgery that we think will, again, improve the outcomes afterwards.
How does using a robot like the VELYS system help transform orthopedic surgeries?
So what these computer navigation and robotic systems allow us to do is to use data during surgery to drive our decision making instead of just using our own opinion of what we think how we should put an implant in. So it's basically just trying to make us better surgeons by using new technology to do that.
One of the selling points of the VELYS is that it's very movable and it's not too large. Can you tell us a little bit about how that helps your workflow in the operating room?
So anytime we introduce new technology into the operating room, it certainly changes the workflow of the steps of how we put in a joint replacement. Historically, the footprint of computer navigations and robots was fairly large in the operating room. And so the newer devices that are coming out have a, quote, smaller footprint in the operating room so that it makes them more movable, so that they can be manipulated in and out as we need them, or from one operating room to another operating room, so they can be used more commonly. In the past, sometimes they would have to live in one operating room. So if you were doing knee replacements, they would maybe have to all be done in that room instead of being able to utilize multiple operating rooms and transport the robot from one room to another.
This has been Ask the Doctor, presented by our friends at Northside Hospital, Cherokee.